Are the medications you take every day silently increasing your risk of a heart attack?
In this video, we'll explore 6 common types of drugs that may unknowingly affect your heart health and what you can do to stay safe.
Before we begin, remember, this video is for educational purposes only.
Always consult your doctor or healthcare provider before changing or stopping any medication. Let's get started.
Number 1. Hormonal contraceptives.
Hormonal contraceptives have given women safe, reliable control over reproduction and a major step forward in health and independence. But research shows that certain forms, and especially those combining estrogen and progestin, can slightly increase the risk of blood clots, stroke, and heart attack.
Estrogen influences blood clotting by increasing certain clotting proteins.
This can make the blood stickier, especially in women who smoke, have high blood pressure, or high cholesterol.
A large Danish study involving over 2 million women found that users of combined
Hormonal contraceptives had about twice the risk of heart attack or stroke compared to non-users, though the overall risk was still very small. Safer options? Progestin-only pills, implants, or IUDs show much lower heart risk, and some, like the hormonal IUD, show no added risk at all.
Number 2. Non-steroidal anti-inflammatory drugs, or NSAIDs.
medications like ibuprofen, diclofenac, and naproxen are used daily for pain, fever, and inflammation.
But overusing these can quietly stress your heart. NSAIDs block COX enzymes, and the same enzymes that help protect your heart and blood vessels.
This disruption can make your blood vessels tighten, increase blood pressure, and make platelets more likely to clump together and raising the chance of a heart attack or stroke.
The FDA warns that this risk can begin within the first few weeks of NSAID use and increases with higher doses or longer duration. Always use NSAIDs only when needed at the lowest effective dose for the shortest possible time.
Number 3. Certain diabetes medications, like rosiglitazone.
Rosiglitazone, a drug once popular for type 2 diabetes, helps improve insulin sensitivity, allowing the body to use glucose more effectively.
However, multiple studies found it could increase the risk of heart failure and possibly heart attacks.
Its effect on fluid retention and cholesterol levels puts extra strain on the heart, especially for those with existing cardiovascular disease. Because of this, rosiglitazone use has declined, and other options like pioglitazone or newer drugs, GLP-1 agonists and SGLT2 inhibitors are preferred today.
If you're taking older diabetes medications, it's worth discussing with your doctor whether switching to a newer, heart-friendly option might be right for you. Number 4. Certain antidepressants. Depression and heart disease often go hand in hand, and antidepressants can truly be life-changing.
But some types, especially tricyclic antidepressants, or TCAs, like amitriptyline or nortriptyline, can affect your heart rhythm. They can cause irregular heartbeats, palpitations, or dizziness due to changes in how the heart conducts its electrical signals.
They may also lower blood pressure suddenly when standing up, increasing fall risk in older adults.
Newer SSRIs like fluoxetine or sertraline are generally safer for the heart, and though high doses of some, like citalopram, can still slightly lengthen the heart's electrical rhythm, known as the QT interval.
If you have heart problems, ask your doctor which antidepressants are safest for your cardiovascular system.
Number 5. Pseudoephedrine decongestants.
That sinus-clearing cold medicine in your cabinet may be doing more than just opening your nose. Pseudoephedrine, a common decongestant found in many cold and allergy pills, works by tightening blood vessels. While that helps reduce swelling in your sinuses, it can also cause your blood pressure and heart rate to rise.
For people with high blood pressure or heart disease, this can be dangerous.
There are reports of pseudoephedrine triggering irregular heartbeats or even heart attacks in sensitive individuals, especially when combined with caffeine or energy drinks.
Always read cold medicine labels carefully and avoid pseudoephedrine if you have heart conditions or take other stimulant medications.
Number 6. Corticosteroids, such as prednisone and similar drugs. Corticosteroids, such as prednisone, are powerful anti-inflammatory drugs used to treat asthma, arthritis, and autoimmune diseases.
But long-term or high-dose use can lead to high blood pressure, high cholesterol, and elevated blood sugar,
all of which increase the risk of heart attack over time.
They can also cause fluid retention, which adds strain on the heart, particularly in older adults. Never stop steroids suddenly. Always taper with your doctor's guidance.
Ask about lifestyle or medication adjustments if you're on long-term steroid therapy. Heart attacks often have multiple causes, and medication side effects are just one piece of the puzzle. Never stop a prescribed medicine without your doctor's approval.
But knowing how these drugs affect your heart helps you make smarter, safer health decisions.
Stay informed, stay healthy, and take care of your heart. It's the engine that keeps your life moving. If you found this video helpful, don't forget to like, subscribe, and click the bell icon,
So you never miss the latest health insights from Dr. Andrew.